Hey, welcome to another episode of Sex Ed with Mel in 30 minutes or less here at Jefferson County Public Health in Jefferson County, Colorado. This month we're going to talk about family planning. Now, some people will say, what's family planning? What does that word mean? Well, we asked our youth advisory board what they thought it meant, and they told us that they thought it meant planning for a family vacation or getting the kids ready to go to school in the morning. Really? Not quite. It means choosing the number of children to have in a family and the length and time interval between their births. So why would somebody want to do that? Because by putting some thought into what you want your future to look like, it helps you to plan for it and increases your chances of success of achieving that future and by living your life instead of letting your life live you. It helps you to stay in control of your destiny. Also, when you plan your pregnancies instead of just letting them happen by surprise, they tend to result in healthier moms and healthier babies. Well, the first thing is to decide do I want to have kids? And for some people, they know right away, yes, absolutely, I want to have kids at some point in my life. Some people might be a little bit more ambivalent, thinking, well, maybe, but we'll see where my life takes me. I'm just not sure right now. And for some people, the answer is absolutely, nuh-uh, I do not want kids now or ever. And they're totally firm in their decision. And any answer to the question, do you want kids, is totally fine. It's just a matter of finding the solution and strategies to work with you so that you can continue on, the life plan that you want to set for yourself. If you decide that children aren't something that you want ever, or maybe something that you just don't want right now, then you need to think about, am I having the type of sex that might result in a pregnancy? And if it is, then you might think about maybe not having that type of sex until you're ready for a pregnancy to happen. Or if you do choose to be sexually active, to take methods into consideration to where your chances of a pregnancy happening will be decreased. And so how you can do that is choosing not to have the types of sex that will result in a pregnancy, or you can choose to use condoms or some other method of birth control to even further help you in your not having a pregnancy right now goal. So, and remember, the only 100% way to not get pregnant or to cause a pregnancy is to not have that type of sex. If you decide that, yes, children are something I want and that I want to start planning for, then there's definitely some things that you want to think about that go along with having children. Things like, where do you want to live? How will I provide for a child or children? How will we feed ourselves? What kinds of schools do I want them to go for? If the answer is yes, I want to have children, then the next thing that you want to think about is, when do I want to start having children? What do I need in my life to make it be the right time? For some people, that might include achieving certain milestones, like being a certain age, or maybe goals that they want to achieve before they start having children. So for some people, they might say, the right time for me is going to be when I am 24 years old and I have a good job and I'm in a stable relationship. Those are going to be the things that I need in my life to be ready to have children. For some people, maybe age might not be the marker, but other things like graduating high school or graduating college and getting started in their career or job path might be what they need to get ready. So, think about those things that you want to achieve before having children, or, the things that you need to be able to provide for those children and how you'll plan for them when you're considering whether or not you're ready to have children right now or at some point in the future. If I want children, or if I already have one, then how many total do I want to have, and how many years apart do I want them to be? That's another thing that you might want to ask yourself when you're thinking about, is now the right time to have children, or how many do I actually want? It's a good idea to think about when you want to start having kids, but it's also important to think about how many you want in total and how far apart you want them to be. Studies have shown that when women are able to space their pregnancies, so when they're able to have a couple of years between delivering each child, it gives their bodies a chance to rest and heal and tends to result in that same goal as before, healthier mamas making healthier babies. So that's a good thing to consider too. Some people might want a further time span between their children. Maybe they want them 5 years apart. Maybe they only want them one. That's a decision that only you and your doctor and your life circumstances can dictate. And also when you're thinking about maybe do I want to have more than one child, think about all of the things that go into consideration for, the providing for one child, things like housing, medical care, food, all those types of things, and then double it or triple it, depending on how many children you're thinking of having. So those are also some things to consider in, when thinking about how many children you want to have and when. Also remember that only you can decide if you're ready for having a child right now. You want to think about, why do I want to have a baby? Is it because I want one, or is my partner or my parent or someone else pressuring me to have a child that maybe I'm not ready for right now? Another thing to think about is, how will having a child affect my relationship with my partner? Are we both ready to be parents? Because remember, it does take two to create a baby. Another thing to consider is that if I'm not in a relationship, am I prepared to raise a child by myself? Who will help me? What kinds of resources might I need to access? If you're not sure about that, or if you're on the way to having a child and you're not sure what kinds of resources or support there might be out for you, dial 411 on your phone or 211, and that can connect you to your local resources. Another thing to think about is, how will having a baby right now affect my school or career plans? Because ultimately you have to live life the way that you want to live it. If there's goals that you want to achieve, then make sure that you can do that, either by delaying when you have your child or ready to have a child, or if you have a child now, how can you accommodate around having that baby while providing for that baby and still achieving the goals that you want to achieve for yourself? Because it can totally be done, but sometimes it might seem a little overwhelming. Another thing to think about is, what will you do for childcare if you go to school or work or need to go out without your child for some reason? So things like that are all things that you might want to think about when you're deciding if you're ready for a baby right now. There are lots of things that go into planning for your life and your future, and thinking about your family planning is only one of those things. Ultimately, we're here to help. You might have heard of things called family planning clinics. There's lots of them, and there's one here in Jefferson County. So what do we do at a family planning clinic? Well, we provide educational, comprehensive medical and social activities which enable individuals, including teens, to determine the number and spacing of their children and to select the means by which this is achieved. Whether that means planning for not having sex right now, but deciding when might be a good time later, whether that means being sexually active right now and helping you to accommodate for that and to choose a method of birth control that works for you. This all goes into that. We also provide sexually transmitted disease testing and management and prevention, and sexuality education, preconceptual counseling, and some degree of infertility management, and provide all the methods of birth control and teach people who want to use them how to use them correctly. If you're ready to plan for your family or need help getting or using a method of birth control, give us a call for an appointment. If you don't live nearby, then Google Family Planning Clinic in your city to see where there might be one close to you. That's it for this month's episode of Sex Ed with Mel in 30 minutes or less. Stay tuned for next month's episode of birth control methods, what they are and how to use them.